all of these statistics that WHO released last week, you've been studying this issue for many years. What was most startling to you about those statistics?
Well, the number one thing is that we revised the numbers in this new report because we have much better information from some countries that is coming from special studies, and I am particularly impressed by the study that was done in Nigeria. That was quite a good survey that allowed us now to say that in Africa there are many more cases than we thought because of Nigeria, and worldwide there are many more cases than we thought, which comes up to roughly 500,000 more cases than anyone thought until a few months ago. And that also has increased the burden of mortality caused by TB. We are talking 1.5 million deaths, 4,000 deaths per day. So I think this was one of the main messages of the new report.
So, Doctor, if 60% of the new MDR TB cases are in 5 middle-income nations, what are the prospects for containing it?
Well, it's an opportunity if they are in 5 middle-income nations because they include countries such as India, China, Russia, Pakistan, and Ukraine. So these are not the lowest income country in the world. If they invest what they need to invest in building diagnostic capacity so that you can diagnose the cases as quickly as possible, in building treatment capacity, in buying the drugs that are necessary, in building the system to be able then to contain MDR-TB and rather cure MDR-TB really in patients who are affected with it, then we have a chance. And so in a way, the fact that the majority of cases are in these 5 countries is an opportunity, and we really need to see that as the way to contain the global epidemic. If they contain MDR-TB, the whole world will contain MDR-TB because they are responsible for about 2/3 of the cases.
And you mentioned Ebola. How has the focus on Ebola affected the ongoing crisis of TB?
Oh, well, that's a very serious business. This is a human tragedy, what is happening in that part of Africa. And what we have is actually at the moment relatively scanty reports, but what we understand is that people in Sierra Leone, Liberia, or Guinea that have been working as district coordinators for tuberculosis have been now essentially shifted their priority towards containing Ebola. So that, of course, affects the TB program as it affects any other program in those areas. We understand even more, in a way, I'm more concerned even by the fact that what has been reported is that in those countries, sputum smear microscopy now, for instance, is not being done because of fear of transmission of Ebola through the sputum. And we also hear consistently that populations in that part of the world are afraid of going to the hospital. I hear that from colleagues that work in maternal and child health, for instance, that women don't go and deliver in health facilities for the fear of getting infected with Ebola. So every program, every activity is being, in a way, touched by the Ebola crisis over there, and the sooner this is solved and faced, the better it will be for every other health program in that part of the world.